Tonsillitis. Tonsillitis is a common condition in which the tonsils, located at the back of the throat, become inflamed and swollen. It can cause pain and discomfort, making it difficult to swallow or speak. Warning: this video is for educational purposes only. An expert advice of a qualified healthcare professional is always required to diagnose or treat any medical condition. Symptoms of tonsillitis. Painful throat. The most common symptom of tonsillitis is a sore throat. It can be mild to severe and often worsens when swallowing. White spots. Some people may develop white or yellow spots on their tonsils, indicating an infection. Swollen glands. Tonsillitis can cause swelling in the glands of the neck, making it painful to touch. Fever. A high temperature is a common sign of tonsillitis, especially in children. Causes of tonsillitis. Bacterial infections. The most common cause of tonsillitis is a bacterial infection, often due to Streptococcus bacteria. Viral infections. Another common cause of tonsillitis is a viral infection, such as the common cold, flu, or mononucleosis. Weakened immunity. People with weakened immune systems may be more susceptible to tonsillitis. Diagnosis of tonsillitis. Medical history and physical examination. The doctor will ask about symptoms and examine the throat and neck for signs of inflammation or infection. Swab test. A swab may be taken from the throat to check for bacteria and viruses. Blood tests. Blood tests can help determine if the infection is bacterial or viral in nature. Treatment options for tonsillitis. Antibiotics. Antibiotics are often prescribed for bacterial infections. Pain relief. Over-the-counter painkillers can help relieve pain and reduce fever. Rest and fluids. Getting plenty of rest and staying well hydrated can help the body fight off the infection more effectively. Complications of untreated tonsillitis. Breathing difficulties. Severe swelling of the tonsils can interfere with normal breathing. Ear infections. Tonsillitis can spread to the middle ear, causing infection and discomfort. Rheumatic fever. Untreated strep throat can lead to rheumatic fever, which can cause heart damage and other serious complications. Prevention methods for tonsillitis. Wash hands. Germs spread easily, so it's important to wash hands frequently, especially before eating or touching the face. Avoid close contact with people who are sick. Avoid close contact with others, particularly if they have a sore throat or other symptoms of illness. Good oral hygiene. Regular brushing and flossing can help prevent the buildup of bacteria in the mouth and throat. Conclusion and summary of key points. See a doctor if symptoms persist. If symptoms of tonsillitis persist for more than a few days, see a doctor for diagnosis and treatment. Take medications as prescribed. If prescribed medication, take it exactly as directed by the doctor. Stay hydrated. Drinking plenty of fluids can help ease symptoms and speed recovery. Thank you for watching. Please like, share, and subscribe.